Oh, fancy. Okay. All right. So module three today, we were talking about like pretty much general stuff for all medical part and legal part so far. Uh, but today, um, just hold on a second. All right. So medical terminology today. We're going all the way deep down. So medical terminology, and we also gonna dive a little bit into the overall medical system. We will dive a little bit also. Actually, we can. Where is that? Yeah, there you go. So human anatomy. So we have to know what the doctors are talking about. We're gonna jump into common medical conditions. So also um, something that is very important to not be mistaken. Medications, purposes. Eventually, yeah, we're gonna hop into the healthcare system, and I have, I think, 3 or 4 videos for us today, and we have some case studies. So something that we can all have a chat about it, and yeah, let's see how that will go today. All right, human anatomy. So as we all know, we have few different major systems. Um, Respiratory system, that's number one. So here, that's how we breathe. Digestive, that's how we eat. Nervous, that's how we think or we walk. Musculoskeletal, yes, musculoskeletal. So that's bones, muscle, joints, um, our movement. Cardiovascular, here, we're, well, that's what's going on inside our heart, our veins, our arteries. So the last one is the urinary. So that's where our kidney works, pretty much. Uh, as an interpreter, your role will be to recognize whenever you are participating in the interpretation, you will need to recognize at least basics. So that means um, if you will hear anything system related, any terms, any terminology, you it's good to recognize what part of the body they might talk to about. The same thing if we're sending anything or asking about appointments, and let's say our booking team will say like, oh, so they're gonna talk something about their nervous system, so that gonna be like a green light for you. Okay, so it's like the spinal cord, brain, nerves. Maybe there is a damage in any of these, so at least you will know what's going on. Um, if we go a little bit deeper, so our like the levels in our body. So like everyone knows from biology, probably lessons. I'm not sure how does it call in Canada. Um, so the basics is the chemical part. So our cells. So that's the cellular level where that's where the life starts. Our tissues. So again, connection, the structure, the muscles. That's where the nerve system is also working on. So if you guys gonna look on this pretty blue guy, um, that's where the communication jumps between the nerves as well. If we go in further, we have organs. So organs, so all part of our body pretty much. So heart, liver, lungs, brain, you name it. Eventually, we are going to the systems, and well, eventually at the end, you have the complete our body. So that's pretty much how that's gonna work. And I will try my best to talk about this starting from the beginning. Um, hey, medical interpreters, do not laugh at me if I'm gonna make any mistakes, please. If there will be any, please correct me. I'm counting on you. All right, so chemical cells. What's the cellular level? So basic building, like the molecules, the cells. What's that else? DNA, you name it. And that means you will need to understand whenever there is a problem in the if there is a session regarding any of those, um, you will need to know how to provide the information again as accurate as possible. So in that case, I gather up a couple of information what might be like the most main common types, uh, things that you might be involved with. So let's say anything related to like the blood cells, that might be something going on during the sessions. Anything about proteins, anything about eventually skin and lining, like what's going on. Other than that, you have those four main types of connection, kind of, right? So like you have the skin covering, then you might to hear about like the connective side, so like uh, the molecules and the DNA stuff. So something like that might be involved, but probably it's going to be on the like higher level for a high risk sessions probably. This will be this probably I will not put this on the exam. This is mostly just so you can know like what's going on, and that will be provided to you in the written materials as well. On that level, we're gonna focus a little bit. We're gonna probably skip a little bit of this chemical part, and we can jump to maybe organs and eventually the systems, right? All right, so participating to any medical appointment, keep in mind you are not a doctor. So even if you had experience with any problems that you can relate to during the meeting, you cannot advise, you cannot tell them anything. You're there only to interpret, right? So if we starting again from oh, come on in. I have to punish people who are getting late. All right, so let's start from the tissue. So muscle tissue, basically our skin, the nervous, if there is a cut or anything, and that's where the communication between nerves is going as well. You might be called for that type of appointment. Maybe emergency, maybe a car accident where you will need to um, help deliver the message maybe to the family. Yes, there is a person that was in a car accident. The cuts are here, here, and here. And if you will hear something, a word like a tissue, because doctors are using those terminologies, so at least you will know what's going on. For the organs, again, they might talk about this as well, especially if maybe the car accident was very bad and the person, well, let's say their lungs collapsed. They cannot breathe anymore, right? They have a problem with their liver. Their heart stopped beeping pretty much. So that's where the organs are coming on. Another thing will be like the whole body. So usually the doctors use a whole body. So they use that terminology, the whole body. As an interpreter, you will need to understand the hierarchy of the structure, and like you don't want to mess up different terminologies whenever you're providing the translation. So if they will talk about the tissue, you will know that this is not an organ. If they will talk about the organ, you will know like, hey, this is not the chemical cellular level. so you cannot confuse the words. I recommend to have at least some kind of glossary, like a general glossary. There is plenty of them if you will just Google it, where you can download a lot of different glossaries for the medical terminology in those four types. I will also try to provide something so we can check it out. Okay, so let me just play the quick video here. Number one, which is related to like the human body and how. Oh, okay. All right, let me just stop this one here, and we're gonna play this one here. Come on. Okay. Everyone can see that. No, we cannot see that, I guess. All right, let's try it one more time to share that screen. So let's share it. Oh, there you go. All right, now we should be fine. Good. All right, so let's play that video here, and probably it will explain a little bit more than me. But yeah, let's see.
Complex network of cells, tissues, and organs that together make life possible. 10 major systems are responsible for the body's functions: skeletal, muscular, cardiovascular, nervous, endocrine, lymphatic, respiratory, digestive, urinary, reproductive. The skeletal, muscular, cardiovascular, and nervous systems in particular create an infrastructure that facilitates the other systems. The adult skeletal system is a framework of over 200 bones. They hold the body together, give it shape, and protect its organs and tissues. The skeleton also provides anchor points for the muscular system, which includes 3 types of muscles: skeletal, smooth, and cardiac. They are found throughout the body and facilitate movement. Nestled within these muscles is the cardiovascular system, a pipeline that includes the heart, blood vessels, and the blood itself. Also called the circulatory system, the cardiovascular system delivers oxygen, white blood cells, hormones, and nutrients throughout the body. Lastly, the nervous system is a communication network of nerve cells that the body uses to transmit information and coordinate bodily functions. It's comprised of the brain, the hub of sensory and intellectual activity, the spinal cord, and the many cranial and spinal nerves that emanate from them. This infrastructure, created by neurons, blood, muscles, and bones, allows 3 other systems to regulate the body's environment: the endocrine, lymphatic, and urinary systems. The endocrine system is a series of glands that use information carried by the nervous system to help regulate the body's processes. Thanks to this neural connection, endocrine glands, such as the thyroid, are aware of the amount of hormones and other chemicals they need to produce. These chemicals are then distributed throughout the body by way of the cardiovascular system. The cardiovascular and nervous systems are also utilized by the lymphatic system, a collection of lymph nodes and vessels that help regulate the body's defenses. Also called the immune system, the lymphatic system uses neural pathways to transmit information about affected areas of the body and then sends out healing agents like white blood cells via the bloodstream. Another key regulatory system is the urinary system, which includes the kidneys, ureters, bladder, and urethra. The urinary or renal system maintains the body's electrolyte levels and filters waste from the blood. This waste is sent through the blood vessels into the kidneys and then expelled as urine. All of these systems require energy to function, and that's where the respiratory and digestive systems come in. The respiratory system is a group of passageways and organs that extracts life-giving oxygen from the air we breathe. Air enters the body through nasal cavities, travels down the throat, and is then transported to the lungs. The lungs extract oxygen for the body to use and then expel a carbon dioxide byproduct when we exhale. Energy can also come in the form of food. The digestive system is an approximately 30-foot series of organs that convert food into fuel. Food enters the system through the mouth, then moves into the esophagus, the stomach, and the intestines. Nutrients are absorbed into the body while solid waste is expelled through the anal canal, the end of the digestive tract. No matter the role, size, or shape of any of the body's systems, each began with the reproductive system. This system is responsible for creating life. The primary organs involved differ between the sexes, with ovaries, fallopian tubes, the uterus, and vagina found in women, and testes and a sperm channel found in men. Together, fertilization may occur, organ systems form, and then a child is born. Humans are complicated organisms, but when our 10 major organ systems are healthy, they ensure our well-being.
So, as you guys see, we are very complicated, to be honest. But yes, you will be assigned to a lot of different sessions, eventually in the hospitals, in the clinics, in any special appointments, any private clinics as well, where you might interpret in a different topics related to all those systems, and you need to understand like what is the difference between them and how they work. Maybe not on a academic level, but at least the basic level that you can recognize what is the doctor talking about whenever you can explain, and that will also kind of help you to find the words that you can find for your interpretation, like in your language or in English. So that's very helpful to like understand the idea of that. Okay.
It was too fast. Where can I find to review this?
What's that?
It was a little bit too fast. Where I can find to review this? Like I want a little bit more watch. Or
Oh, I will send that everything tomorrow.
oh, okay.
Yeah.
Okay.
I will create. Yeah, you will get everyone will get the overview like the last week for this.
Okay, thank you.
All right. So hopping to regional division. So what that actually means? That means same like the level of the systems and the body. Like we can divide parts of us as different divisions, right? So let's say starting from the top, you have the head and neck, right? So that's where everything related to those, to your head, to your brain, to your skull, to your nervous system, to maybe your eyes, to your ears. There's a lot of different things, and that's where we can connect it to the first division, right? The second division is the chest itself, pretty much, right? So in that case, we're talking about the chest itself, heart, lungs, blood vessels, like all the major blood vessels we have here. And again, maybe there was someone that fell down, there was a car accident, broken ribs, for example, right? So that's again where you might to be involved in the translation for this particular region division, right? Other than that, we are going lower, so we have the back level, And here we're talking again, maybe broken spine, muscle joints, spinal cord. So everything related to the back pains and stuff, and anything like numbness or neurological issues. That's where we are gonna connect it to the division of the like for the back, right? Uh, Another level which is separate are the upper limbs. So your arms, like shoulder and hands and arms, pretty much, right? So again, bones, uh, any problems with the movement, muscles, maybe. Oh well, I'm a good example here. I had my bicep tendon was ripped off. So something like this, you might to be visit the hospital, the doctor for the surgery for that. So biceps, triceps, joints, shoulder, elbow, wrists, like you name it, fingers. So for that, that is the upper limb, right? The lower limb, well, those are your legs, pretty much. So the foot, again, all the bones in your legs, muscles, knees, joints, hips. So that's the lower one. All right, so you can also divide those things in your if you want to create yourself a glossary, and that can also help a little bit because in all different regions you might to participate in sessions like for example for head and neck if we have maybe a sinus infection, maybe there's a chronic migraine going on, right? um, or anything that happened. Maybe it was a head injury. So at least, so now you know. Okay, so that's like the upper, like the head and neck region. For example, if we hop into maybe lower limb to legs, like sort of like swelling, cramps. Um, Again, any injuries, broken legs, um, anything related to like bones and knees and any weakness in walking. So that's at least you will know like okay, so that's that part, right? So at least we know. Now there is also something that we can call as a common denominator for all three major systems. So let's say for number one, it's going to be cardio. So if you hear cardio, it means about the heart, always, usually. Um, if you will hear neuro, because you might have like so cardio something, neuro something, so that will tell you okay, so neuro will be nerves, cardio, that's a heart, and mostly the blood vessels. Um, then you have the pulmo, which is lungs. That's how you breathe, right? So for like all the medical terms, usually like whenever we receive the request as well, we have the references to like let's say very common lately is the hypertension, like cardio vascular something, right? Or we have a problem with like a respiratory infection. So that means okay, so that's going to be with the lung system. So beside the vocabularies, beside the terminologies and stuff, I'm usually also helping out all interpreters who do participate those serious appointments where we can create something more about the topic. So like a definition, what you should be prepared for. Um, what might be the common terminologies used for this, but from your end, it's good that you have at least idea that whenever you go into the hospital for the session for that topic, like you will know what they're talking about. Like you don't have to now just tell them, okay, just wait, I have to see what you guys talking about and start googling stuff. You will know pretty much right away what's going on and if you can help or if you cannot help with it, right? All right, next one. Why is it not working? There you go. All right, so terminologies. That's where we all struggle. And we're gonna try to go a little bit about this. So, common medical terms and common medical conditions. So, in this case, again, for anything that is not very common, like it's a very sensitive topic. Usually, hospitals or companies are hiring like certified medical interpreters who can actually join the sessions and be at those sessions. But for us, um, we can focus on a little bit, let's say, less risky sessions. So the common medical condition, let's say, right? Um, Hypertension, yeah, that's something very common. So that's the high blood pressure most of the time, and that's what probably we can help with interpretation, right? Diabetes. So here we have also the level 1 and 2, for example, and well, here we're talking about the blood, like the blood sugar regulation issues and stuff, and in this case, interpreters should be able to at least provide like the basic interpretation. Um, Asthma probably is very common. Arthritis, again, the same thing. Now, infections. So in this case, it depends, right? Also, it very depends from the like the mental issues where we have, let's say, depression. So for the last two, usually we need a little bit skilled interpreters who not only provide a good and accurate interpretation, but who can understand the topic as well. So, and that topic is mostly to understand like from the basics. What's like what is it about, especially with the mental health and depression and stuff. So that's where usually we take in people who can focus on the session, can be patient, can help out during that session in that communication. So there's a lot of different situations where that is needed, right? Um, Whenever the patients try to describe how they feel, if they feel pain, probably based on your like on your language, on your country, on your culture, there might be a little different descriptions of their problems, right? Um, if let's say the patient will say, "I'm thirsty 24/7. I'm thirsty, and I feel tired all the time." Right? So in that case, like they do not understand what's going on with them, uh, and in that case, we can relate that either to maybe diabetes. We can round it up to also like a little bit under like the obvious like the high blood pressure. Um, let's say if there's an asthma, for example, right? So if they will start talking, okay, I can't breathe all the time, or there is a problem with that. So you might to understand, like, okay, so we're dealing with this as well. Um, the judgment for this a problem, I can leave it to you because you know the best how people might to describe problems with their health in your country. Um, so that's, but I encourage to like keep focus on those signals whenever people try to explain that, um, and they can't find the proper word. You might to help them out in that communication, and you might to tell the doctor what's going on right away as well, especially if there's like emergency or something and they want to just uh, say quickly what's going on. So at least like whenever you have an idea and you can help, that's going to be that can sometimes it can save a life as well, right? All right, I have another two movies which are pretty interesting because we're going to see what happened um, if you provide a bad translation. And we actually didn't have many of those videos, so I'm pretty happy I was able to find this. So let me just quickly open here. All right. So here we actually have a diabetes case, and it's a family matter. So that's something that we can relate and can be very helpful.
Welcome back to MedLingua Practice, where language meets care. I'm thrilled you're joining us for our 8th video. Today, in part 1 of 7 common medical interpreter mistakes, bad versus good examples, diabetes case, we'll dive into a real-world OPI scenario with a child's type 1 diabetes diagnosis. We'll break down the bad interpretation step by step, highlighting key errors that can lead to confusion and mistrust. Stick around for part 2 coming soon, where we'll flip it to the good side and show how to get it right. Let's jump in. Hit like if you're ready to level up your skills.
Mrs. Marie, the tests show that your child has type 1 diabetes. He will need insulin therapy.
Madame dokter a di pitit wak gen diabet paske li manje trop bagay dous.
Diabète? C'est pas vrai. Moi pas quoi nouvelle ça. Petite moi pas même qu'on mange bagay douce. C'est parole pour ou di interprète.
She says you're wrong. She doesn't believe you.
Now, let's break down why the interpreter in this over-the-phone interpretation scenario made mistakes. In OPI, everyone is talking remotely, so the interpreter must be very accurate because there are no visual cues like body language to help. The interpreter's job is to repeat exactly what is said without changing or adding anything. Here's what went wrong, step by step. 1. Adding wrong information. The doctor said the child has type 1 diabetes and needs insulin. The interpreter wrongly said in Creole that it's because the child ate too many sweets. This is not true. Type 1 diabetes isn't caused by eating sweets. It's an autoimmune disease. Adding this wrong reason confuses the mother and gives her bad medical information. 2. Leaving out important details. The interpreter didn't say type 1 diabetes in Haitian Creole, just diabetes. This is a problem because type 1 is different from other diabetes types and needs specific treatment. They also didn't mention insulin therapy, so the mother doesn't know her child needs insulin shots. In OPI, every word matters, since there's no way to see gestures or clarify in person. 3. Not staying neutral. Interpreters must only repeat what is said, not add their own ideas. Here, the interpreter added their own guess about sweets causing diabetes, which the doctor didn't say. This breaks the rule of staying neutral and can make the mother trust the doctor less. In OPI, interpreters must be honest and repeat exactly what is said, even if it's about their own mistake. 4. Misrepresenting the mother's words. The mother got upset and said in Creole, "That's not true. My child doesn't even eat sweets. You, interpreter, are making this up." But the interpreter told the doctor, "She says you're wrong. She doesn't believe you." This hides the interpreter's own error and blames the doctor instead. In OPI, interpreters must be honest and repeat exactly what is said, even if it's about their own mistake. 5. Causing confusion and conflict. By saying the wrong thing about sweets, the interpreter made the mother argue, "My child doesn't even eat sweets." This confusion could make her doubt the diagnosis and delay treatment. In OPI, mistakes like this are serious because there's no face-to-face chance to fix misunderstandings quickly. 6. Ignoring cultural needs. In some cultures, people might think diabetes comes from sweets, but the interpreter should have used correct medical terms in Creole. By saying something wrong, they might make the mother feel judged or confused. Interpreters need to use clear, accurate words that fit the culture and language. 7. Not following OPI rules. In OPI, interpreters should speak as if they're the person talking, like your child has, not the doctor says. This interpreter used the doctor says, which makes the conversation feel less direct. They also didn't pause to check if everyone understood, which is important in phone calls to avoid big mistakes. These errors turned a clear medical talk into a confusing and upsetting one. A good interpreter would have avoided these problems by being accurate, neutral, and clear.
That's all for part 1, folks. Hope this.
All right, let's have a chat. Let's have a chat. What do you guys think about this? I need to ask, tell me honestly, how many of you made the same mistakes on your phone calls? Right? I'm guessing you didn't even realize where you trying to do interpretation, and yes, it can sometimes you might to say something wrong, you might to express something wrong, or you might to skip something. And I'm pretty sure
On a phone call is weird, especially sometimes it's doing something between, focusing the brain is too many things. So on the phone call could be make a mistake.
Yeah, so phone calls are sometimes it sounds like it's easier because I hear that it's easier for people because yes, you don't have to have people around you. You're just alone and you can focus on interpretation. But sometimes I also hear from the experienced interpreters whenever they were starting, it was kind of feel like you can put on the slack a little bit more. You can be a little bit more lazy when you provide the interpretation because no one's watching you now, and you can skip some stuff that you think that are not important. No one gonna check it out. No one can confirm that because it's just a phone call. There is no recording for this, so there's a lot of different things. But the problem starts. Let's say if there's a phone call and maybe there's more than 3 people involved and one of the persons speaks the language, and those complaints will gonna come up eventually. So
you were right. I'm focused more in person.
Yeah, it had happened. Yeah, the phone calls are not that easy, I will say. They're not that easy. I think that actually in-person sessions might be easier because I guess you can fix your mistake faster when it's in person. Maybe on the virtual sessions as well, you can fix it up. Also, probably during the virtual sessions, your face mimic can kind of like fix it as well. So I guess that depends. Anyone else have any feedback on this? Okay, everyone are scared now, huh? Don't worry, guys. We're not judging here. I will not fire you. You'll be fine.
I have not.
We are here to learn. So that's the whole idea. So yes, if anyone made even tiny mistakes, you can see like it's pretty actually interesting. Like the video was like what 3 minutes. That dialogue was barely like maybe 15 seconds, and if you can make 7 mistakes in 15 seconds phone call, yes, it can be, we cannot turn it back probably anymore. Bing Wen, go ahead, please.
Just want to say for a risk of the phone call interpretation is about the time, because I worked in a company before and I have to translate for I think 7.5 hours every day.
Okay.
Almost without break, and that made my brain just burn out.
Yeah.
So just want to let everyone know to make sure you have enough break time to confirm you can have a better reflection, I can say.
I believe, yeah, you're right. Like I know a lot of different companies is doing that whenever interpreters are only doing remote sessions, and I think it's kind of like you actually have your shift. Let's say it's 8 hours, and you are sitting on the standby, and those calls are keep coming.
True.
you can feel burnout at some point, right?
Yeah.
Yeah, I don't know. They should probably provide some kind of break, like, hey, here's a 1 hour break at least or something. But I also want to mention that pretty soon we also gonna enter this type of sessions. Maybe not like sitting for 6 hours, but we want to start the 24/7
Okay.
for the clients, and that's going to be mostly for medical, for hospitals. So
Perfect.
if that's going to work, well, we'll see. I'm going to look for probably good interpreters for this with experience and knowledge. So we'll see how it goes. Like right now, again, we're waiting for the green lights from government.
Okay. So I'm waiting for that.
All right, let's quickly. Oh, there is one more. Yanina, go ahead.
Yeah, hi everyone. From my own experience, I find the most challenging thing for me during the phone call interpretations is that most of the times they are out of the context because you do not know any history of the previous calls, and sometimes when the conversation goes, yeah, remember we discussed it last time, or this is a no for your request from the last time. And for me, it's kind of challenging because sometimes the person is like, what did we discuss? And because you were not the one who was doing the last time's interpretation, you didn't know what quality of the interpretation was provided last time and what understanding the person has from the last time and whether it's correct understanding of what has been conveyed to them. So this is the most challenging for me, at least.
Well, that's something that probably we can have more impact whenever we can say in the next meeting, either with IHS or WCB. I'm guessing you're talking about WCB here, probably.
Yeah, most of the times here it's WCB.
Yeah, so the case managers, as far as I know from my experience, case managers are trying to contact the clients every 2 weeks or every 3 weeks. And then they're just getting, yes, there was a conversation, let's say, about signing them up for the physio. And now they're asking, like, hey, do you remember, like, yes, we were talking about this and I signed you to the physio. So how is it going? And yes, you can be lost. As an interpreter, you're just joining pretty much. It's like watching the show and you're just joining the 5th episode, certainly, right? So, and there is no summary. There was not like previously what happened. You can try to ask the case manager if she can give you a quick context, maybe just, what you guys want to talk about. And that can also maybe, if all of you are going to start doing that, maybe it will change also their way how they provide those calls. Because usually, yes, they do not actually care much about the interpretation. They're just, they're just talking to the claimant. And as we mentioned 2 weeks ago or 4 weeks ago, I'm pretty sure the person doesn't even remember what happened those 4 weeks ago. So, yeah, that's something we can also educate WCB case managers about that. Whenever if it's like a very important topic, very difficult topic, maybe like a follow-up after the surgery or something, yeah, it will be good if they can provide you at least like, well, here we're going to talk about this because we had a conversation, 3 weeks ago, for example, right? But something, yes, definitely I can note down and maybe we can fix it at some point. So yeah, thank you for that.
Yeah, thank you. Yeah, usually I do ask a little bit of context because I do want to convey the right message. I don't want to misinterpret. So yeah, I usually do ask to provide more context so I do interpret correctly and the person actually understands whatever is going on.
That's good. Diana, you have something?
Hi, Peter. So I'm trying to understand this. I don't exactly have this. It's kind of confusing me a little bit because unless something is, I get a call that is of a particular difficulty related to some special case, then in general, actually, when the more context I try to provide, for me, it's less helpful and can be more confusing. Um, in general, because I don't keep notes, and I tell them I destroy notes. And if it's in general just normal calls of like how are you doing, and in terminology that I'm used to, I don't require to have context, even if it's like completely new calls that are follow-up calls. That's just my experience. I'm not saying because I don't understand, I don't know the situation of the previous question, but I'm just saying, I just want to make sure that what I've understood, because I don't want to be confused, that as I understand that as long as I am interpreting in first person, and no matter how, if they say, if I make the corrections or ask kindly for repetitions, as long as I stay within that area and I'm not trying to provide explanations, but I just interpret exactly what they're saying to the other language, then I in general I don't find that I require any context, unless it's some kind of say the claimant is explaining something complex or too fast or something, then I clarify. But in general, I don't get into that situation. So I'm trying to understand this question, and about like where, in what case would you need for every to have like to get a context before the call. Because for me, if they were to change that, for me personally, if WCB or any of the companies were to say before they start the call, if they were to try to, okay, I'm going to tell you this call is about this and about that, unless it's about something that I am unfamiliar with or some vocabulary, special vocabulary, it would probably just not be useful for me. It would just confuse me more.
Yeah. No, the random follow-ups are fine. You guys can just, you're just doing your job, and you're doing just translation. That's all. But if there is like something that you feel like, that's your judgment. If you feel like, oh, I might need a little bit information here to like have better idea in my head, I believe like, yeah, just a little question, asking like what you guys want to talk about. If this is like, it will help me understand the context a little bit more, so that can help. But if they just want to have a quick chat, like, hey, you're going to the appointment tomorrow, well, yeah, you definitely do not need to know the context of their conversations from 2 months ago. That's totally fine. So yeah, we don't want you to be confused for that. That's for sure. So I would say yes, that's your judgment. And whenever you feel like you might, I would say more like a legal and medical sessions that might need a little bit more context. But that random WCB calls, those should be fine, because usually I would say 80% of those conversations, they're just scheduling people for the sessions. Or they just want to have a follow-up, like, hey, how are you feeling today? And whenever I'm looking at the reports, how long those phone calls are taken, it's like 2 minutes, 30 seconds, or 5 minutes, right? So those are very quick conversation. And I can relate to myself, because I was in WCB for 6 years after my accident at work. And I had those conversations too. And sometimes, yeah, the case manager called me, and they were just asking random questions like, hey, how are you? What's going on? Do you need anything? Okay, bye. I'm going to call you in 2 weeks. Also, sometimes they're only not the case managers are calling. There very often is their procedures for WCB is that the case manager is the main person for the claimant, the person who made decisions. But whenever a decision is made, they provide that to their assistants, and then assistants are taking care of the claimant until there is any drastic change, or there's something happen, or something need to be provided to the client. That's when, again, the case manager is hopping in. So most of the time, even if the client was talking to the case manager, let's say January 1st, all the calls until June might be done only by the assistant. So yeah, probably like you said, Diana, you don't need to have a context all the time. However, I will leave that judgment to you whenever, as an interpreter, if that will help you to understand and provide better interpretation, you can ask them. Shouldn't be happening anything. Alejandra, go ahead.
Hi, Peter.
Hi.
So regarding the conversation you're having, I think it's case on it's like case to case basis, because like, for example, I had made many translations over the phone, and yesterday it was quite funny actually, because the one I got yesterday, they called me and they were just assuming I'm like the claimant's translator, and I've been following up with her case or something, but because they were assuming I knew what they were talking about and I had no idea, so this was kind of challenging. And then the claimant was kind of getting frustrated too, because I was interpreting, but she's like, I don't understand what you're saying. And I'm like, well, I'm just repeating. And he's like, oh yeah, but like we did like last times. And I'm like, I was not the translator last time, so I have no context, or I didn't understand what they were talking about. But like in other cases that I have, this is the first time this happened. Like they were just assuming I knew what they were talking about, or that I was the interpreter before. So I had to like make that clarification so they could talk in a context that I would understand, or that kind of situation happened yesterday.
Yep. So that's kind of like also answers Yanina's questions. That's where you kind of like want to help them out also with communication, so you can get a context. But yeah. Okay. Well, let's hop in to the next one. So we have to rush up actually. Okay. It's 4 o'clock already. All right. Come on, medication. So medications will be involved in the cases all the time. Some of them we all know. Some of them are very common. Some of them not. Any painkillers? Well, we know those. Any ibuprofens? If there is Tylenol involved, maybe morphine eventually, the ketanol or something. So if those things might be used, you're probably gonna know what is this. So something that you can memorize. Usually, if they're talking about these medications, it's either to kill the pain or they're talking about the side effects. So again, if let's say they're talking, for example, well, let's take ibuprofen, right? So they can talk about the medication itself. So the name of the medication, they can talk about. Yes, it will relieve the pain a little bit here, and like mild and moderate pain. It will help with that, but keep in mind, because let's say there are side effects and it can upset your stomach, for example. So here you have like 3 different terminologies already, where you have to pick it up like pretty quickly. What's going on, right? So those, I'm guessing, those might be the easiest one. A little bit difficult to probably will be with translation might be the all kind of antibiotics. That's where the probably can. I'm guessing you can also ask the doctor before you will provide the interpretation. But again, the whole idea of antibiotics is basically to fight all the bacterial infections in our body, right? The worst case scenario side effects, I will go maybe for allergic reactions. So there can be allergic reactions to that. So again, you have another 3 different terminologies here that you can talk about. What else? Well, we have if we can take under as a example here the diabetes situation. So we have the insulin, and again insulin. So we have again the insulin itself. We have the blood sugar. We have the pressure issues. Eventually, the side effects can be like if not taken, your low blood sugar will like go under the level that can be life-threatening, right? That can happen. So medications will be there all the time, and you need to be aware of that to provide the best interpretation, like pretty much translation, because you need to provide word to word in that case. You cannot change anything here. So no one says you have to memorize them, but if you at least recognize the type of the medication, like, or the purpose, and that can at least help you provide the information to the patient, right? So that's something that can to help out, right? If there is any particular questions from the let's say from the patients, like let's say they are talking about the antibiotics, and the patient want to ask, well, I want to know more about the infections, and I want to know more about the side effects. So you need to be prepared that the doctor going to talk about that, and they might use some kind of vocabulary that might take a little bit of time to like process that in your head, right? If you are not sure, that the most important part, if you are not sure about the medication terminology, always ask for clarification. Like, this is very important, especially when they're talking about the dosage of the medication. So number one, the dose. Number two, timing, when the patient need to take that. You need to be 100% sure that those information will be provided accurate. You don't want to mess up this one. Let's say, yeah, again, the side effects. The patient need to understand absolutely fully what can be the side effect. If there will be any miscommunication, well, it can end pretty badly for them, right? So that's, I guess, something that we have to we have to understand, like, how serious are those sessions, and a little mistake can lead to a lot of complications, right? All right, something a little bit easier now. So, healthcare system. So we were talking yesterday about the legal system. So today it's a little bit more about the medical system. So we have the primary care, which is, in this case, let's say under as an example, we have Alberta. So primary care. Now we have Alberta Health Service. Then Alberta Health Service is in charge of pretty much all those things that are happening in the different places. From there, we go into specialists, maybe private client, maybe private appointments. Eventually, you have the hospitals, clinics, emergencies. So that's pretty much how we can go, right? If we're talking about the people itself involved, so we have the family doctors, we have nurses, pharmacists, I guess. What else? Support people, insurance companies, any coverages, so any like basics coverages. So again, here, like, well, accuracy will be important. You need to know how to kind of like see those terminologies whenever, let's say, there's a family doctor, maybe there's also a nurse, they providing the prescription, doctor is talking about something, so you need to pick up all those signals whenever you have to provide the translation, right? So in this whole healthcare, even if we can say, yes, doctors are important, nurse is important, all the healthcare support stuff are important, well, you are important. And again, like yesterday, I have to say, you guys played a very critical role here, because the patient need to understand what's going on, and they need to understand the whole message. So in this whole healthcare system, even if you are not involved in healthcare itself, you're just joining like randomly on from time to time, on that day, whenever you join those sessions, it is very important because patients often don't know how to ask questions, what questions should be asked, what if the answer will be there, how to, if they do not understand the answers, they don't know how to explain the symptoms sometimes. So that's very important that we have the person who can translate, who is from the same country most of the time, or from the same culture. They can help navigate that patient to tell like what's going on and eventually explain that to the doctor as well. So that's something very crucial that you guys need to understand. So again, you are the heroes in legal and medical settings. Keep that in mind. Very important. All right, just quickly about the roles. So again, the doctors or family doctors, well, usually those are the primary care people, right? So whenever there's an issue, the family doctors are doing those checkups, their follow-ups, any referrals, prescriptions, right? So all those things can happen. And yes, sometimes I'm not sure if AHS is sending people to family doctors. If someone did anything family doctors, you guys can just tell us in a few minutes. So again, if you're an interpreter in that session, you have to be sure and understand what questions the patient is asking, what kind of referral patient is getting. You need to be sure that they're all on the same page. If there is a prescription, explain the dosage as well, ask for the clarification if needed, because whenever that patient will leave the room, you guys might not meet anymore. And yeah, if there is anything wrong, yeah, we don't want that. That's a bad scenario, right? Emergency hospitals. So here is a little bit more happening. And those are usually like the more urgent, I would say, complex situations. And let's say there is a huge car accident on the highway, I don't know, 25 cars, and everyone are going to the emergency. Let's say 5 people do not speak English at all. And suddenly you are landing in that chaos. So in that case, people will be confused. They don't know what to ask questions. The doctors might to ask what's going on, where is the pain and stuff, and they might be in shock. They will be confused. They do not know how to answer the questions. So that's something that interpreters can also help to kind of like tell them like, hey, I'm here to help you out. I will translate what you say. You have to tell the doctor where's the pain, like what's going on with you. And eventually, if the patients will kind of like calm down and the conversation can finally flow, that will be something where the doctor can start asking the actual questions, and then the patient can reply, right? So something that can happen. Some of the emergency or hospital appointments will not be in person. Those going to be on the phone. So just be prepared for that. And like we were talking about here, you might have no context at all in those. Like they just want information and they just want a translation. They don't have time for explaining the context, right? So if something like this is happening, just don't take it personally. Don't take it like, okay, they are rude or something. They just need to fight because every second counts. So just keep that in mind if something like this is happening. What else? Well, nurses usually are our good angels that are helping out after that. So monitoring the hospitals, helping out the patients, guide with the medications where pharmacies sell. So they're the professionals still that can ask questions, have a conversation with the patient, and again, it's good to have an interpreter who can help them out during that, right? All right, so what else do we have here? Practices. So the best practices for you guys. Well, I actually prepared a couple scenarios here. Let me just quickly take a look here. Okay. All right. So case studies and scenarios. I try to find something that can actually help understand like the whole role. So for example, patient complains of shortness of breath, right? The interpreter task here, like your role pretty much, will say the same to the clinician, to the doctor. And if the patient will say that, what do you guys think that will rely to? If the patient complains of persistent shortness of breath. So if someone have an answer, go ahead.
Asthma. Heart attack.
It's asthma, right? Someone said it's asthma. So,
Yes.
all right. So if we talk from the beginning of the slides, so which system does it affect? Anyone remember?
Respiratory.
Yes. Yes. So system, respiratory, condition will be asthma, and what medication might to help here?
Inhaler.
Inhaler.
You guys are good. Okay. Okay. I like it. So by the way, something like this might be also an exam. I have something another question. Patient reports frequent urination and excessive thirst. So the system.
Endocrine system.
All right. Condition.
Diabetes.
Ooh.
Diabetes.
All right.
Baby.
Medication.
Metformin or insulin. It depends.
எல்லாத்தையும் ஒண்ணா போடுறாரு இவரு.
Well.
என்னவோ வயிறு கெட்டு போய் கிடக்குது கண்டதையும் திடீர்னு சாப்பிடுறது திடீர்னு சாப்பிடாம.
JJ, hold on. Okay, we'll mute you. All right, so yes, interpreter pretty much. There's technical terminology here, and you can explain that in a very plain language that the patient can understand what's going on. So yes, it is urinary, diabetes, insulin. Well, there might be some oral medication as well, but I will say insulin is going for that, right? Well, I'm not sure. One of those questions are way too simple for this. Patient complains about the pain, joint issues, and stiffness.
Maybe it's osteoarthritis. Osteoarthritis.
Of course, it was Akram. Yes, it is.
Yeah.
Yes, it is. So, okay, wait, hold on, Akram. So, medication.
Medication. Sometimes the doctor use cortisone for relieve the inflammation.
Okay. Yep. So, yeah, probably. So the discussion here might be probably about, changes in their lifestyle, right? Or about the exercise, maybe more often. Or
physical therapy.
Yeah. Yeah. So there's, so at least now you know that, all right, so this is related together. Well, this is too easy. Oh my, okay. All right, so for the best practices, again, try to provide as much accurate information. Keep in mind, there will be a lot of different terminologies going on, a lot of different systems. The other thing that you might be a witness of is abbreviations. So abbreviations are also happening. Sometimes it can be written on the medical reports, or sometimes it might be involved in a conversation. Let's say maybe there's a doctor nurse talking or something, or they trying to explain to the patient, right? So I would say the most common probably abbreviation will be the BP, which is the blood pressure. So if they're just going for the BP, HR, if you're gonna see, yeah, that's the heart rate, pretty much, right? BMI, that's again, so here we have, oh my gosh, BMI, body mass index, right? So for some of these, like I recommend also have something, just a cheat sheet maybe, so you'll not get confused if they're gonna start talking in a quick, shortcut sentence, right? So that can happen. Okay, I have last video, and then we can hop into Q&As. So let's have the last one here. Those are, where is it? True stories, apparently. So we're gonna watch some true stories where the code of ethics is involved, and hopefully it's something valuable. So that will be the last one, and then we can hop in to have a chat.
Hi, everyone. I'm Erin. As you've maybe already heard in the
Oh, did I stop it?
previous video, if you took a look at it, I like to share some stories. Stories tend to set up the context and what the experience is, and are a really rich foundation for growing and learning from other professionals. So I'm going to share a story of a time when needed to think critically through a scenario and what the expectations are of the interpreter, and apply different things such as advocacy, role boundaries, impartiality, all of those things kind of meshing together, including accuracy and facilitating direct communication. So in a pediatric scenario, a patient had received a vaccine. And so with this type of vaccine, it was the first time the patient was receiving the vaccine. So the recommendation would be that she stay in the clinic, in the exam room, accompanied by her mother for about 15 minutes, just in the off chance that she were to have some type of reaction to the vaccine. So we knew that there would be this 15-minute waiting period after the patient had received the injection. And so, of course, the nurse goes off to the nurse's station, and I stand out in the hallway, and the patient and her mom, of course, stayed in the room. So a few minutes pass by, maybe 5 or so minutes, and before I know it, the door opens to the room, and so I, of course, respond, and it's the mother, and she's kind of nervous and a little bit tense, saying that her daughter is becoming ill and she doesn't know what to do, she needs a nurse. This is a clinic situation. There are not emergency or nurse call light buttons or anything that you can do. So if I'm thinking through the application of how to interpret the protocols and direct communication, I would have needed to have said, oh, thank you for letting me know that. And again, I was speaking in Spanish, but keeping this in English for everyone. Let's go down and find the nurse and let the nurse know what's going on, and then you can interpret for her, and or speak to her, and I'll interpret what you're saying, and then you can respond back. You see how long it's taking me to even set this up, right? We have a critical incident happening where a patient needs some type of medical response. So instead of insisting that the mother walk with me down to where the nurse's station was, I just let her know, one moment. I knew where the nurse's station was. I went down there immediately. I said, nurse needed immediately. All the nurses stopped what they were doing, and they came with me down to the room, and they were immediately able to assess the situation. So if I had been thinking very strictly about how to apply the protocols of the interpreter, it would have resulted in delayed care for the patient and unnecessary additional steps or protocols in being able to communicate what the incident was that was going on in the moment. So did I step outside my boundaries? Absolutely not. I made critical decision in the moment as to how we can immediately call the attention of a medical provider given the tools and resources that we had available to us at that time. And at that point, that was my feet walking down to the nurse's station quickly, getting somebody's attention to then come back to that patient room and then respond to and handle the scenario. And neither did I have to call the patient's mother away from her to then go find the nurse. So sometimes there are scenarios that throw a little curveball into our processes and how we ordinarily go about things as interpreters. But when we think about what is the point and what is the purpose behind the code of ethics, behind the standards of practice, behind the protocols, we're able to take a look at scenarios that don't quite fit very neatly into the different contexts or situations that we're finding ourselves in, And in healthcare, that does happen, and we're able to still adhere to the code of ethics while making sure that the scenario has the best possible outcome. So I'd like to hear your stories as to when you were having to think through the code of ethics or protocols in perhaps a little bit different or a more critical way than simply do A, then B, then C, where maybe you have to be a little bit more creative. Not thinking so much in black and white, but maybe thinking in full color. Thanks for taking a look at this video. Looking forward to hearing your scenario.
All right. I'm listening. Who's first? Questions, feedback. Come on. Give me something. Where are our medical interpreters? Guys, do you have any experience with something like this that happened and you were involved?
Not yet for me.
You guys are quiet today.
For me, not yet. So I want to learn. Yeah.
Okay.
For me, not yet, but I want to say almost all of my clients, their English, in fact, are pretty good. So I'm just, most time I just stand by.
Really?
Yep. True.
Well, all right. So I have to put a note. Do not send Big One anywhere anymore. All right. Well,
just
so,
an interpreter. So it's for free. It's included in that in their.
Yeah.
It's their benefit anyway, right? So.
Yes, yes. I'm just kidding. Yes, we are aware that some of the patients do speak English, but they also not always they need an interpreter. They just need someone to be there with them. Someone who understands what's going on, especially if they're a person from their country as well, and they feel more comfortable as well. So it's not that you guys always provide interpretation. Sometimes just being there is giving a lot to people that need that help during the sessions. So that's something that you can keep in mind as well. All right. So just from me, for summarizing everything, whenever you will be assigned to medical appointments, especially for Alberta Health Service, I'm not sure if we have anyone here from other provinces today. But yeah, to any hospitals, any clinics, from our end, usually I'm trying to help to provide some of the patient appointment details that I can know that can help you out. But I encourage you guys can have those cheat sheets for medications, for some of the procedures to tell different things, some vocabularies here and there. It can always help. It can always help, and believe me, no one gonna yell at you if you're gonna just pull out a quick note and just take a look at it, right?
Thank you. Thank you. Can you also assign me, please, very often? So I want more experience and learn by doing also.
Oh wait, is that to me? Are you talking to me? Sorry.
Yes. Yes. Sorry. It's too low. My voice is too low.
No. Well, right now we're gonna have to go through a lot of the process of evaluation and stuff to see who will be qualified.
Sorry about that. Okay.
But yes, we're gonna assign more people and more to that to help out. So hopefully we're gonna have a full team for this.
Hi, Peter.
Yes.
Sorry for the interruption. So from that our role, it will be like you said, if the Santa translation get us for the information as much as you can from your side, so that would help us to get ready, not only the terminology, but also how to prepare mentally as well. especially for the AHS. I had an assignment actually from the AHS a couple of weeks ago, the first time.
Mhm.
And that's all I got was, what is it? Long-term care.
Okay.
So that was a senior, like a senior home,
Okay.
more advanced. So I got in at the place, all the detail. So I searched up where it is, what's the place for. And it's more advanced. It was that the door is closed. It's more like dementias, those type of ill.
Okay.
And I was preparing for the terminology for the first time, right? So, and then I went, everyone was, so nice. There's a case manager, and it's ended up for that, it's not for the treatment for the patient, but ended up like more like bills, financial stuff.
Yeah.
So
yeah, like I said,
I wasn't prepared for that.
Like I'm trying my best whenever I see something that might require, like for example, I'm not sure if I can share it here. I just found it actually. So here I had like you can see, I'm gathering up those information from the AHS directly. So I'm in touch with the AHS department most of the time if we need something. So again here, we gathering up all information. I'm getting them up from them, whatever is needed, and based on that, this is like for the diabetic stuff going on and the insulin pump. So we have the materials. Those materials are sent to you as well. Plus,
Okay.
I'm creating, like a general glossary as well that can help you out with that and any additional information. So if there is, maybe if there was maybe the appointment I was not aware of that happened, and it can happen as well. If you feel like you didn't get anything and you feel like you need help, you can just let me know.
Okay.
Because sometimes, yes, I'm not aware about all the bookings. Like if we're doing over 600 bookings per day, it's sometimes it's hard to keep track on everything. And maybe at the same
I understand. Yes.
time, yeah, I was maybe helping out the legal appointments, right?
Mm-hmm.
But yes, if any of you need help, if you guys need anything, any materials, just send me an email. I'll be happy to help.
Okay, thank you. Good to know. Thank you, Peter.
Sure, no problem. Also talking about this, I believe people were asking yesterday about those SiliSats and other stuff. So if anyone needed information, just send me an email. If you need something, I'll be happy to send you. You can see like a little bit more in details, like what are the steps and stuff for the, like how to jump to, let's say, medical or legal appointments. Azeb, yes, go ahead, please. Sorry, you were waiting there for a little bit.
I was trying to behave. Next time I won't put my hand up because I've been waiting for a while. I'm just kidding. Just to make you laugh. Okay. Medical could be frustrating. Also very, really serious situation because we are kind of putting someone's life in danger or in safe side. So I had a situation, the person is diabetics, which is diabetics number 1, but diabetics 1, also eating disorder. Those two things are different. So the parents, it may not have a knowledge of what's diabetics and what's eating disorder. So the child was not eating because of eating disorder, but they think because of diabetics 1, that's why she's not eating. That's why they feel. They did not understand what the child is going through. So the medical provider, they did not know where the parent could be, where their knowledge is. So if you notice that, if you observe that from their conversation, because they keep repeating the same thing. When they keep repeating the same thing, which is the parent, you will know where their knowledge is. So you can help out. You can help out understanding the doctor where their parents are, so that they can go to their level and teach them what this disorder is, what's diabetics. They can define both sickness in a different way, because they keep saying, we give her food, but she's not eating, and then they keep saying, the doctor said she has eating disorder, and that disorder is eating, like stopping it from eating. They did not know that. The only thing they are focusing is she's not eating, she's refusing because the eating disorder. Now the doctor went above. They said, okay, eating disorder is like a monster waiting there, so that they can understand. And then there is another one, diabetics 2.1, which is she has to have insulin, she have to have the food is measured, a lot of things. So we sat, and instead of going for 2 hours, I sat over there for 4 hours, 5 hours, because to teach them, to give them the proper education, and then that they can help out the child. So if you know the person has no background of medical background, some of them they can pick easily. Some of them, no matter what you repeat, they may not understand it. So you have to go to their level and teach them. So if you make the doctor understand that situation, it may help out. This is my experience. So because we are kind of putting someone in danger or saving them. So sometimes you don't have to only interpret what they said. Also, you can give them, this is the situation, what I observed, and then they will appreciate it.
No, yeah, I agree with that. Sometimes it can also happen a lot of times, maybe with the elders, when they need a little bit of brief explanation about the situation, what's going on. And or you have, the stubborn people as well, right? They think they know everything, but they don't know anything at the end. And whatever doctor says, they will not agree with that. So that's something where you can be put in all different situations, in all different emotions and stuff as well. But education, I know that hospitals or clinics do provide sometimes educational workshops for, let's say, the parents, maybe for kids and stuff. And from time to time, our interpreters are going there too to help out. So that's something that is happening. And yes, and sometimes those sessions sometimes even taking 2-3 days. But if you as an interpreter are in that session and you can see like clearly the parents or maybe the family is just in the denial and they're just refusing to accept what's going on, I recommend, just tell that to the doctor as well, that maybe there should be a scheduled appointment with them for educational purpose or something. And so in the future, it can be, you don't have to worry about that, and they don't have to be in this situation where something will happen to the baby and they cannot help. So yeah, a lot of beside the difficult terminology, medications, issues, problems, like you name it, you still have the emotions, you still have the human factor, and that can be also a huge problem, and that's where you need to find the best solution, how to approach that as well. So you are not only the interpreter, you are pretty much a full-time guardian angel for them sometimes as well.
Yeah, sometimes the way we approach people makes them comfortable, which is if we kind of humble ourselves, we're not putting ourselves like a body language. It gives a lot of interpretation, right? If someone is exaggerating himself, you will know that person is you're not gonna be happy with him, and no matter what he explain or no matter what gives you the knowledge. If you become humble, helping out, like they are supportive, you are there, like showing him, like showing humanity, you know. The moment they feel that, they will start opening up, and then they will start giving the information what they struggle, and then finding a solution to it. Most of them are stuck how to come out from that situation, what I learned. So I've been, you know what, anything can happen, there is nothing wrong with that, because the doctor said there is nothing wrong with that, you haven't done no mistakes, it just her body or just the sickness attack her, something like that. When they feel that supportive, because sometimes they feel, oh, I caused my daughter to be diabetic, I caused my daughter this. We always put in our shoulder because we don't have the knowledge. So if they feel this can happen to anybody, they will open up more. They will be comfortable more and to get out. There is some parents refuse not to accept anything, and they are putting themselves high. If you see that time, you just back up, because they may attack you even tomorrow for you by giving them advice. But a person that is stuck and looking for a solution, be human, like the same thing. And that's what I learned from interpretation. I'm sorry.
No, that's a good feedback here. Yeah, I like it. That's why I'm happy that we have experienced interpreters here in these sessions too.
Oh, excuse me.
Yes, please go.
So in that situation, it is really heartbreaking. I would definitely understand what she did, but we have to follow as a community interpreter. We have to follow that code of ethics. It's called. We are not the doctor, and unfortunately,
yes, but you are not providing, you're not providing.
We can't educate the client.
Well,
education is the doctor's role, unless it's life-threatening.
So, like you as an interpreter, you're not providing education. You can help to translate the educational materials to the parents, for example, right? So one of the tips I can tell you to still keep the code, but you still need to look, because those are case-to-case situation, and prioritizing the key information that will help eventually to, like, you have to focus on what also affect the patient safety. And
if it's life-threatening, yes.
Yeah, so the doctor need to know that. And you see, like in that video, there was said, like, the lady still didn't, even if she decided on her own to run and grab the nurses. Yes, right now you might say, okay, maybe she kind of did break the code of ethics, but she didn't like go for the boundaries. Like, breaking the code of ethics and going beyond the boundaries will be helping the kid, not calling the nurses. That's what will be the mistake. But making a decision where, and making the priorities here that will affect the safety of the patient and and their health. Yes, in that case, in both cases, the interpreters are right. So the worst thing you want to do is just stay and say like, oh, I can't break the code of ethics, right? But I mean, if there is a patient laying on the ground dying, well,
yeah, that's true. That's it's life-threatening. We have only couple of things we could as an interpreter. It's not more than as a human being. That's very
But you are, at the end of the day, you're also human, and you have to take a look on that. Like, you have to kind of separate those two situations.
It is really hard, and that my situation was also like, the guy was, our client was really heartbreaking situation. It sucks me really.
Well, that's why
rest of the day.
That's the whole idea of providing now these trainings, because that's what we start noticing where the
We need a psychologist.
It
was so heartbreaking, but as in my role, I have to keep my role, and I could attach to the patient really, but that is not my role as an interpreter, so I have to.
Yeah, it's kind of like, I don't want.
It was really hard. It was very difficult.
You're still like, during all those interpretations, it might sound bad, but you are kind of like an actor in a theater. Like, you still need to play your role. You still need to act as it meant to be. And then when you finish the scene and you come down and you close the door, or you be in your car, or you will leave the room, that's when you can get back to yourself again, and that's where it can some of the appointments can impact you
very much so.
And believe me, there can be way worse situations, and we had those situations already. I believe still, well, I wanted to keep it for the different modules, so I'm just going to mention maybe, but eventually you might to also be asked, like, do you want to take participation in the end of life appointment for the family? And that's what can impact you as well. So there is a lot of going on in both legal and medical sessions. Legal will impact you as well as an interpreter eventually, because if you will switch, let's say, from communities to family to civic, and you hop into the critical, like the criminal cases, yeah, they're not fun. They're not. Same thing with the medical appointments here. You might to have, okay, so a quick session with the family doctor where you just need to write, the patient need a prescription. But yes, at the end, you might to end up in some totally like different situations, more complex situations, critical. And that is the part of the role. That's why in all those appointments, no matter where you are and what you do, that's why you guys are the heroes here, because you're taking a lot of responsibility on your shoulders as the interpreters.
Yeah, that's why we need the details as much as we could, so that we could be
yeah, that's why we're changing totally
competence
in this year. That's why the approach is totally changed, because now we're getting more legal sessions before, and more medical. Before, it was mostly focused on WCB appointments, and there were just a physiotherapy, just a gym, maybe some random drama here and there. But here we're talking about actually complex and difficult situations that interpreters might be involved. And well, that's why I came out with this idea, like, you guys need actually see how does it work from the backstage, right? So at least people can have an idea, and now you can decide, like, okay, do I know enough or I do not know enough? Do I want to do it or not? Well, that's going to affect me in 2 days or a week. Am I still going to think about this or not? So those are those dilemmas that all interpreters kind of going to have eventually. I believe even professional interpreters, like the fully certified professional interpreters, have the same thing. And probably we're gonna grab the owner of the company, Mr. Raj, to be the guest speaker in one of the sessions, maybe hopefully this week. If not, then next week, mostly for legal sessions. But he can also share his knowledge and experience based on those critical situations that are happening, right? All right, so
I want to do more. I want to learn also more. So
well, we are all here for that, so we'll see.
Why isn't our people not more, or like why I'm signing less? Sorry about that. This is not a topic, but
well, we'll get to that. We'll get to that. Okay, so just
sorry.
Yes.
Another quick question: do you guys have a medical translation assignment as well? Like not the interpretation, but the translation.
Yes, but you guys are not allowed to do the translations.
Because of?
Well, because you are not certified and you have a notary seal to do that.
Not sorry?
So you need a special stamp for that as well. You need to be certified translator to provide the medical report translations.
How about a few words to
It's not the
translate for them?
TINs? Are you talking about TINs?
No, like actual, you need to be certified translator to provide translation to translate the written forms, right? Is that what you're talking about?
Yes, that the stamp means that like a TINs.
Yeah, like you need to be legal. You'll be legally obligated for each word you're providing. You'll be
for the medical.
Yeah, or legal.
From the ATIA.
Yeah, you'll be legally responsible for that. So our interpreters do not do it. Number one, because yes, you might be legally responsible for that, and probably you don't want that. Number two, we are protecting you as well, and we don't want you to be involved in that. Side translation is totally different. You can help out with the side translation, but the written translations, all written translations are done by the certified translators. Like they actually put their name under that, like I did this and I sign under this and I'm legally responsible for each word that was here, right?
The medical.
Yeah. Well, medical, legal.
Oh, legal.
Immigration, right? So yes, for that it's a little bit more sensitive.
How about the reading for them and explaining?
Well, the reading and explaining, so that's the side translation. So you can help them out. You can read whatever is written in English and tell them that in their language. That's totally fine. But you cannot provide actual like written translation for them. You cannot write for them, or you cannot translate documents for them, like to provide that on the separate piece of paper, for example. So that's something, if anyone is asking you for that, just tell them right away no, because it can end up pretty badly for you eventually. So people are people. And editing can happen, and even if you know exactly what the word means, eventually if something will come and they will complain, they will say, no, Mariana was absolutely not right here. That word doesn't mean that. It means something else, and she made a mistake, and now I want to sue her for $50,000.
Oh no! Sorry. Thank you.
Yes, we want to skip any translation for the clients. That's where leave it for the guys who can be responsible for this.
Thank you so much. What about filling the forms?
We talked about this last week.
I know, but sorry, please.
Go to module 1.
Oh,
sorry?
Module 1, you have there.
I know, just for writing now. So it was not allowed or allowed?
That was the topic I yelled at Zeb because
Yeah, I know. That's why I remember now. We go module 1.
Yeah, there you go. No, do not fill any forms. None.
Okay, thank you.
Sure. Abigail, please go ahead.
Have you had a case where there is a person that is doing interpretation, but at the same time they are they have the documentation so then they can be able to do a translation at the same time in your program? Because could be a case where that could happen, that the person that is doing interpretation also has documentation that they can be able to do translation. Translation at the same time. Is that
Site
possible?
translation. You mean about site translation or actual translation?
Yeah, actually translation.
No.
No? Okay.
No, like most of the translators we are cooperating with are like they're not doing interpretation.
Okay.
So they're like kind of like two different separate things. Right now, the only person I know that might to do that, oh yeah, it's Raj Sandal. He can do that.
Okay.
He's currently the only person who can actually talk to you, providing interpretation, and still do the translation. He's certified translator as well. But that's, I mean, probably there's a couple more people. You know, if you jump into ATIA and you know, other places, there might be some people who can play about. But if they're focusing on one branch, that's where they usually do it. Right. So yeah.
Peter.
All right, guys. Quick summary before we ending today. So.
One more question? No?
Yes, please go.
Okay. Sometimes when we translate from WCB or something, if your case you want be translated or interpreted,
okay,
we can send it to Sandal. So even let's say medical and legal, you need a license to interpret it, to translate. But about the same thing, WCB also you have to be certified for their documents to be translated.
So yes, sometimes I know that case managers sometimes are using you guys, and they sending you letters or something, and like, hey, can you translate that for us quickly? Don't do that, because yeah, again, it should not happen, and also no one gonna pay you for this.
Usually I got those kind of stuff is from the law, which is they send you few pages for reading through the decision what is going to be,
yeah,
and then to give the person what we are talking about to be aware and he can be comfortable to it.
Yeah.
If he has any question that he can raise up, which is his lawyer, him and the translator, they go through that. So this we can do.
Yeah, like you can help them understand what's going on. Definitely. Yeah.
Okay, by reading it and go through every single. Okay.
Yeah, but you cannot have a pen and start writing, let's say in Tigrinya, whatever it says in English, or vice versa.
Okay, no writing. Okay.
Yeah. All right. So summary quickly for today. The things that we have to look at it. Actually, before that, if you guys regarding translation, because everyone are talking about this now. Regarding translation, I know it can be a little bit tempting because now we have the AI and stuff, and you might do like, oh, okay, I can use that. Please don't. Please don't. AI, it seems like it's advanced, but it's not. For interpretation itself, you guys are safe for at least another 10 years, I will say. For interpretation, AI will never handle those complex situations in the medical or legal settings. It can be fine if you want to order a Big Mac. It can help AI. For translation itself, currently, yes, there is a huge, like a global scale of terminologies, but still it can be mistaken. So AI is currently working on the same level, kind of like a Google translation. If you try to put something in the Google Translator, and sometimes it translates you for this, and then you read it and it just doesn't have any sense, right? So AI, yes, it is advanced, but only for little, like I would say, very community casual conversations, not the actual medical or legal stuff, right? So just keep that in mind. I'm not saying do not try to like check it out. If whatever you say makes sense, you can try it. But it's not something that I will go with if providing the interpretation translation, to the client actually, right? What I will look for instead will be like official glossaries. So hospital or government websites where you have stuff going on. If there's like, I'm not sure if ATA or anything like this have it, but yeah, like official glossaries that are actually confirmed, that can help. There are mobile application that actually using the references maybe, or especially for medical, I think there are applications where you can put the medication on and it will show you like what's the general dosage about this, side effects or something like that. So you can have something to explain the patient as well, right? And so that's pretty much for regarding the translation interpretation. So just keep in mind that AI, yes, it's tempting, it's nice and easy, but it can be dangerous. Can be dangerous and can be risky. So just keep that in mind. All right, this last word for today. Going to the session, stay organized as much as possible. Again, if you need help, let me know. I'm here every day. We can work on this, prepare you for this. If we have to, we can meet over the Zoom, or if you are in Calgary, you can always come and visit us. Prioritizing information as well. I would say yes, continue learning, get those glossaries if you need. I will try to find something as well if I'm gonna have a little bit of time to figure that one out, both for legal and medical. And yeah, keep the code. Accuracy, accuracy, and accuracy. Okay. All right. Tomorrow legal. Today's what? Tuesday, right? So tomorrow legal. Thursday we're gonna have the module for medical. Then we have a break, and I will let you know, everyone, what about Monday, if we're doing anything or not. Also, I was doing my research. It's not like I'm not doing any. But I did my research about the cultural approaches and stuff. And Azep, you were right, absolutely, about next week. So we might to actually put something like a reading week, holidays for you guys. So we'll see. Or I can prepare the recordings. Whoever wants to join, then will join, and then we're gonna do the recordings. So absolutely no rush, and I'm not forcing anyone to join next week for the sessions if you have your stuff to do and you are busy. Okay. All right, that's it for today, I guess.
How about we take next week off for the Holy Week?
Well, we can try.
Yeah.
We can vote.
And we can catch up with the recording.
Yes, you can do that. So I will still do the recordings. Yeah, I will still do the recordings, and we're gonna upload them. And yeah, you guys do not need to participate next week. And then we're probably not gonna do the examination next week as well.
Thank you so much.
Yes, I'm a good guy. I'm a good guy. I will respect it, and I will help you guys. So.
Thank you, Peter.
All right. Thank you guys for coming. Again, it looks like we have a pretty stable team now, so I like that. Too bad from one point that there's only the same people, because there's over 600 interpreters and we have only 40 people participating. So.
No, we have 600.
Well, total of active people country-wise currently, I'm working with 721.
Oh, good number.
721.
Okay, Peter. Good night.
All right. Thank you so much. Have a good night. Sakshi, go ahead.
Yes.
Sorry, I missed your question. I'm just reading your email here.
Yes, I was just mentioning that, yeah, please reply to that and let me know your response to that.
Sure.
Yeah, thank you.
Yeah, I will send you that. Can I do it tomorrow?
No problem. I just want a response within next 24 hours because I have to respond to them as well.
Yeah, I see that. Yeah, it will be done. We're gonna work on it.
No problem. Thank you.
Sure. Thank you. Have a good night, guys.
You too. Good night.
Thank you.
Bye bye.
Bye all. Thank you.